Welcome, everyone. I'd like to welcome you to the United Way of Johnson and Washington County's COVID-19 vaccination webinar. My name is Barb Thomas, and I am the Executive Director of Communications and Alumni Relations for the Tippie College of Business at the University of Iowa. It's my pleasure to serve as your moderator today. So before we begin, I do want to make sure that you're familiar that within Zoom, you have the ability to both look at a gallery as well as the speaker view. And you will find that on your computer in the upper right-hand corner, and you can go back and forth. I highly recommend that you go to speaker view so that you can see a larger image of our speakers. So today we will have a discussion on a variety of issues all surrounding the COVID-19 vaccination. Now, we were greatly impressed by the number of questions that were submitted in advance for this webinar, and we want to thank you for doing so. We will do our best to answer as many of those as we can, but please know that we may not be able to get to all of them, and we have sometimes tried to group those together if possible. Our format today does not allow for us to take additional questions from the audience, but know that this event is being recorded and a link to the video will be sent out to all registrants within several days. So it is now my pleasure to introduce our two panelists. Sam Jarvis is the Community Health Manager at Johnson County Public Health. He has been with the department for over 2 years, serving previously as Emergency Preparedness Planner, and has over 9 years total of local government public health experience. Sam holds a Master of Science degree in Health Science from Western Illinois University and a Bachelor of Arts in Biochemistry from Knox College in Galesburg, Illinois. Suresh Gunasekaran is the Chief Executive Officer of University of Iowa Hospitals and Clinics and Associate Vice President for University of Iowa Healthcare. In his role as CEO, Suresh oversees the operational, strategic, and financial performance for UIHC, a regional referral center that includes UI Stead Family Children's Hospital. He has more than 20 years of experience in healthcare administration and healthcare information technology. Prior to coming to Iowa, he served as Chief Operations Officer for the University of Texas Southwestern Health System in Dallas, Texas, and he earned an MBA degree with honors from Southern Methodist University in Dallas. So as we begin our event today, I'd like to actually start by asking Sam to just give us kind of a status report, if you would, Sam, on the vaccination process in Johnson County.
Yeah, absolutely. And again, thank you for the opportunity and thank you for everyone joining us this morning. As always, we appreciate the opportunity to update the community on where we're at on the world's most complex vaccine campaign. As most everyone is aware, December 14th, we kicked off Iowa's vaccine campaign here in Johnson County at the University of Iowa Hospitals and Clinics, and have come quite a long ways. Since December 14th, we've allocated roughly over 55,000 vaccines to our partners to administer here in Johnson County. And this certainly does not include the vaccines that have been administered by our pharmacy partners through the long-term care facility program. Then now, as we've seen, the retail pharmacy program at Hy-Vee and several other pharmacies. So we've made wonderful progress. While it seems slow and largely frustrating at times, we've come a long way since December 14th. As everyone is also aware, the state is under a vaccine shortage order, and Johnson County and its partners have been very careful to follow through with that shortage order to the best of our abilities to ensure that we're getting the doses in the right arms as quickly as possible. Throughout the way, we've seen some changes to that and different timing of when those phases have occurred, and likely we'll continue to see some changes, but we know that February 1st started off our population that's 65 and older. And from what it sounds like from our state partners and even here locally, we've made tremendous progress in that population. And so we've seen, as of last week, phase 1B supplemental has added a lot of folks 64 and younger with underlying conditions. And so we continue to make good progress, and we're really grateful for all of our partnerships. Our hospital systems, we've had such a strong healthcare system here in Johnson County with UIHC, Mercy, and the VA, and all of our pharmacy partners who have really stepped up and assisted us with vaccinating a lot of occupations where we're working through those other tiered priority groups. And so, again, Johnson County is doing a wonderful job with vaccination, largely due in part to all the partnerships and community partners that are helping us. We've had so many volunteers step up and assist at vaccine clinics, as well as volunteers step up and really assist with calling folks who have had difficulties with scheduling. And so again, that kind of effort by everyone in the community really does make a difference. And we've seen the same through the entire pandemic on the disease side of operations with the pandemic. People here understand the importance of wearing a mask and distancing. They understand the importance of the role that they play as an individual to keep cases low. And so on both fronts, outlook is good, and we hope that it continues, and we hope that people recognize and continue to recognize how important it is as we really approach what many are looking at a very pivotal point in the pandemic right now. So.
Great. Well, thank you, Sam. So today marks the 1 year since the World Health Organization declared that we are in a pandemic. So can both of you reflect on how that year has been for Johnson County? Suresh, I'd like to go to you first, if I could.
It's been a year, hasn't it? Really a pleasure to be with you today, Barb. Always good to see Sam. Before I start, I can't but reflect on Sam and his team at Johnson County Public Health. They really have been the backbone of the pandemic response. This is far greater than any individual provider or any individual system, and Sam and his team have done a remarkable job. I don't think that when Sam signed up for this, he signed up for pandemic duty, but I'll tell you that, he and his team have been tireless. They've always looked at the big picture and tried to do right, not just by the county, but also by the state. And it's been a real pleasure to work with him. And I think we're really lucky to have him here in Johnson County. But that's been the reflection of a year. The reflection of a year, there are a lot of folks as talented as Sam Jarvis in this community. And we're really blessed, whether it's within the healthcare community, within the business community, our civic leaders, our universities, our schools. We have just had a total community response to this pandemic, and all of our successes are attributed to our ability to work together. And I think that this is a pretty good report card, a pretty good litmus test on Johnson County, the United Way, and other social organizations that have been part of this journey. We've really been able to come together. There was no rule book a year ago. So the WHO did announce a year ago that we were in a pandemic, but they did not send us training manuals. They did not give us a calendar. They did not tell us how this was going to go. What I think we've accomplished is a great American story. It's a great Iowa story, but it's definitely a great Johnson County story too. And I think in so many ways, there's been abundant criticism in every single moment of the pandemic around various different aspects, whether it was testing, whether it was treatment, and now vaccines. And all of those criticisms are really valid. But I would say, let's not forget the tremendous successes that we've had. And we have been able to invent a playbook that has been more than acceptable to save so many lives, to help so many people reach assistance and do those things. But I'd be remiss in saying that a year later that we don't reflect on how painful it has been. The human toll has been significant. And over a period of year, we've somewhat become desensitized to it. But I saw a pretty tough poll this week where it surveyed 10,000 Americans, and over half of them personally knew of someone who has lost their life to COVID. And I think we need to take a moment to reflect on all that has been lost, but also we should take a moment to actually celebrate what we've been able to do as a community, because I don't think we could have done it any other way.
Great. Thank you so much, Suresh. Sam, what are your thoughts on that past year?
It has been quite the year, and then really reflecting here at the department, many of us were talking in the hallway. March 8th was when the first cases were announced here in Johnson County, and there's several of us who were reflecting on where we were at when we got the call to assemble our team and really get to work. And really, who knew where we'd be going or where we'd be at? It's certainly been a year of ups and downs. But I think overall, as Suresh had mentioned, a lot of successes. And it is really a reflection on the community and partnerships, whether it's with our long-term care facilities and emergency management agencies, our hospitals, our pharmacy partners with Towncrest and Hy-Vee, our social services, and so many others. It really is a good reflection. It is phenomenal to be in a community where people say, what can I do and where can I help? And when you've got a lot of folks saying that and doing that, you get a lot done and you make progress. So it's always phenomenal and very humbling and grateful to be here.
Well, I think I can speak for everyone when I say that we are appreciative of the two of you in your roles, because you have both really shown leadership and helped us move forward through this. So here's one question. As the vaccine supply improves and the weather makes it possible for outdoor events, do you think it would be possible for a mass vaccination clinic to happen in Johnson County?
Those are absolutely possibilities. Again, a lot of what we've seen so far is largely due to our supply that we're receiving. But to say that we're not doing some mass vaccination, certainly we've seen a large and high throughput clinic through our partners at UWJWC. We've seen that with some of our pharmacy partners. So, if we were given 20,000 doses to get done in a weekend, I have no doubt that our Johnson County community could get through those. But as supply increases, we'll continue to see a lot of other options open up and be provided.
Suresh, anything to add?
No, I think that, we also need to understand mass vaccination for us versus other areas is going to be different. I know when we look at Chicago or Dallas or San Francisco or these Los Angeles, you do see these mass vaccination clinics where they are 5,000, 10,000 people in a day going through one clinic. It's really important to understand those are communities that have a total population of 20 to 30 million, in that metropolitan area. And so for us, proportionate to our county's population, having sites where we could have 1,000 or 2,000 doses given in one day is pretty mass vaccination for a place like us. And every single week at UIHC, we do take the mass vaccination approach. We get all of our doses from Sam, and all of them are given on one day. And so sometimes it's 1,500, sometimes it's 2,000, sometimes it's somewhere in between, maybe a little bit less, but we do it, and it takes a pretty big chunk. But the real headline is what Sam said, which is that whether it's us, whether it's Towncrest, whether it's Mercy, whoever it is, we don't have enough doses to do that 7 days a week in any model. And so all of us are getting it out as fast as we can, but it's really that vaccine shortage order. We have yet to be given a week where we just had so many doses, we didn't know what to do with it, and so we've just been really thoughtful of trying to make sure that while we're mass vaccinating, Sam brought up another important point. It's equally important to make sure that we make sure that there is access to all the communities that need access to the vaccine. And sometimes when you do these mass vaccination approaches, it's not the best approach. It doesn't easily get it into all of those different communities. And so I think Sam has been really thoughtful about that. And I think we've been intentional, not trying to do everything as a mass vaccination, but to have multiple different locations, multiple different partners, so that different aspects of our community can get there.
Great, thank you very much. So Suresh, I'll direct this one to you. We've had a number of questions that deal with medical concerns and the safety of taking the vaccination if they have issues such as HIV or past reactions to other vaccinations. Now, while each case is different, are there some things that you could recommend to those people?
Yeah, I mean, I think that the number one information is provided through the CDC. And as you can tell, for both of these now 3 vaccine candidates, there are very few, relatively few contraindicated conditions, meaning that in general, the manufacturer of the vaccine, having done clinical trials, having received FDA emergency use authorization, has a very narrow corridor of contraindications, meaning that the vast majority of adult Americans are going to be eligible for these vaccines, and they have been proven to be safe for the vast majority of adults. However, there are always going to be segments of our community that need to be a little bit more vigilant. If you always have reactions to vaccines, that's a pretty good indication that you need to consult your provider before you get this vaccine, and make sure to get it in a location that knows that you might have reactions. Other specialized conditions, if you're a transplant patient, if you're a cancer patient that's midstream in therapy, it just makes sense to talk to your provider and just validate. Is this a good time or should I wait? But I will say that the headline here is that the vast majority of adults should be able to safely receive this vaccine. But it always makes sense to check with your provider if you're not sure.
So as a follow-up to that, we did have several questions that dealt with concerns about fertility issues. What should a woman who is thinking about, starting a family or having another baby, should they be concerned?
Much of those concerns have been disproven, and I know that we've seen a lot of information from the American College of Obstetrics and Gynecologists that they're encouraging providers to offer vaccination to pregnant women, lactating, or considering to have a family in the future. So again, as Suresh mentioned, this is available to much of, if anything, the entire public. So
great. And this kind of links to that, is that we also had people ask about young children and whether they believe that the vaccine safe for young kids.
Well, right now, the 3 that are available are under emergency use authorization right now for the pandemic. And they're licensed right now for those who are 18 and older, or if it's Pfizer, it's 16 and older. From what it sounds like right now, Pfizer and Moderna have clinical trials going on with younger persons. So yet to be determined, but we hope to learn more throughout the year, where eventually we hope they'll be available. So I'm sure a lot of folks are hoping they'll be this summer and before the next school year starts.
Absolutely. So I know that many of us are very anxious and looking forward to the opportunity to get the vaccine. Will people have the opportunity to actually choose which of the vaccines they get? Or is it basically, right now it seems like if you're lucky enough to get a scheduled appointment, you probably should take what you're offered. But will people have that option to choose?
In the future, that's absolutely something that, we definitely see happening. But right now, really the ask is, when you're eligible, when you've been offered the vaccine, please take what's available right now as soon as possible. We really do want to get doses into arms. That's important. One, to provide protection, but also keep transmission low, which sounds like all signs are pointing to good outcomes for that. So really right now, again, it's a pretty pivotal point. We're wanting people to get vaccinated when it's offered to them. So.
And I think that's an important point, is that there's a lot of media interest, social media interest on, is one more effective than the other? And, is one more reactogenic than the other? I think it's really important to understand that we are still in a pandemic. We are still in a journey towards normalcy. And just like we had to stick together on this before, I think it's really important that we stick together and take the vaccine that is available to us as quickly as we can. And, there has been some attention to the fact that the Johnson & Johnson vaccine might have a lower effectiveness range through the trials than the previous two did. Let's be clear here. The data is very, very clear that the Johnson & Johnson vaccine is very effective at preventing hospitalization and preventing death. And so all three are equally effective at being able to prevent hospitalizations and death. And so I think it's really important that during this period of time that all of us avail ourselves of whichever vaccine is available. And at this stage, with a vaccine shortage order, I'm not aware of any vaccination partner in Johnson County that is allowing individuals to shop for their vaccine. You know, you will not call UIHC and then pick off of a menu what you would like. And I would just say the community standard in general is just to offer it. And the other piece I would like Sam to comment on is that we don't have 1 month's worth of supply visibility. We only know what we're going to get very last minute. Would you be willing to comment on that, Sam?
Yeah, absolutely. So throughout this entire process, we've really not known the amounts or the types. And so there's some, interesting or complex logistics that are going on behind the scenes. I think many are aware that Pfizer at one time was a vaccine that people began to hear about these special freezers that had to be stored in, and the logistics that took to handle it. And certainly there's the differences between first and second dose. And so really what we're working with is really some insight 1 week at a time of how many and really the amounts of each. Pfizer comes in a chunk of about 1,170 doses, Moderna in 100. And so really when we're getting two different types and looking at the flexibility of our partners and what they're able to handle and their capacity comes into play. And when you've got all of that to look at every week with a week's notice, really we're working with what we get pretty quickly.
Excellent. So another kind of medical question in a way, if someone tests positive for the virus within the last year, so they had the virus, what are the chances of them becoming reinfected, and should they take the vaccine?
It sounds like reinfection is rare, but it has occurred. And in terms of whether they should get the vaccine, we're still encouraging folks if they've been ill in the past to get vaccinated. The only time is really if they're still infectious, right? And that's less so because of their illness, but more, if they're ill, we're asking them to stay home, and we're not wanting them to expose other healthcare workers or pharmacists.
So in the vaccine rollout, we know that every healthcare workers were a priority, and that certainly for individuals with disabilities and their caregivers, if they're in a facility, both the individual and the caregivers are receiving the vaccine. However, frequently for a disabled person who might be in the home, that situation may be slightly different in that their caregiver may actually be a family member. And so, and by some standards, that may mean that they're ineligible at this point in time. Do you have any advice for individuals such as that are taking care of someone with a disability at home in order to make sure that they are covered, taken care of as soon as possible?
Yeah, absolutely. And to provide some clarification around that, we are looking at a lot of those folks that are under what's referred to as CDAC waivers. And so we're doing our best to address those situations as they come up. So we are reaching out to those. We've worked with a lot of our, we'll say MCO partners to reach out to folks, and certainly other case managers as well too. So.
Thank you. So we know that the vaccine is now available in a number of different places, but I would say for the common man, it might be a little confusing to know where all they could possibly receive the vaccine. We certainly know that our area hospitals, but can one or both of you just provide some additional insight into those other community partners that are helping in this effort?
Right now, currently, as you've mentioned, our hospital partners are playing a very large role in assisting with vaccination. They're helping us with a lot of individuals. Within the past month, many of our pharmacy partners have helped us with those who have been prioritized by their occupation or their role. So really, when we're looking at phase 1B and even with the phase 1B supplemental change, we look at it sort of with, there's an age eligibility, and then there's the occupation or role kind of eligibility. And so our hospital partners have stepped up and they're taking on those individuals and really expanding not just to their patients, but to the entire community. So a huge thank you to Suresh and his team and our partners at Mercy. And really our pharmacy partners have been really gracious to either do on-site clinics or really do a heavy lift of reaching out to those employers. Much of our process has been to establish a point of contact with a lot of those employers and agencies and really coordinate their staff of who is eligible. Because certainly we're wanting to take our limited supply and stretch it as far as it can go, because we really want to reach everyone that's eligible in that tier or that group of that tier. And so at times we've asked if you've got employees who are going to continue to telework or they've got no really public facing role to wait at this time. And many of them understand why. We're really wanting to get those who are eligible and those at most risk.
Great, thank you very much. So kind of as a follow-up to that, do you have advice for those people who are self-scheduling? You know, there's been a lot of stories about, you know, people logging into CVS or Walgreens at midnight or 2 a.m. trying to get those appointments. Do you have any advice for people who are trying to make sure that they get a scheduled appointment?
I would recommend not sleeping. I would say that you should try at all hours of the day. No, in all seriousness, I mean, I think that the nature of this is to understand that at every stage of this pandemic, we always think that it's not going to get better, and it always does. And so I think that there is a good chance that we will not run out of vaccine this week. So if you don't get on the Hy-Vee website this week or CVS this week, it really will be there next week too. And there may even be a shot that there's more chance, you know, there are more appointments and stuff available. And I think the reality of the situation is this is such a big lift to reach out to folks that self-scheduling is just a reality. It's not the fairest, it's not the most equitable in general, but at a certain level, it's the fastest way to get those doses out. You know, at UIHC, we spent a good part of the month of February not doing everything online. That meant I had 25 employees that were pulled off of their jobs just to call people to get them in, because we thought that would be the best way to get to individuals older than 65. Not many companies have 25 employees that they can pull off to do this. And so it's really important to understand that it's a reality of where we are. And if you are lucky enough to be able to access online scheduling, please take advantage of it, but don't let it mentally get to you. We really do think the estimates are correct. Over the next 30 days, I think that online scheduling is going to get easier and easier. I also think there are going to be lots of locations outside of Johnson County that people can schedule themselves into that may have more abundance in these things. And so I would hope that we can continue to remind everyone of the optimism, and so that you don't need to lose sleep for the next 3 days to figure this thing out, because it will get better, and we are making a lot of progress.
Thank you very much. Now, I've also heard from different people that you know, certain pharmacies, not so much, you know, maybe the larger organizations, but certain pharmacies may get a certain amount of the vaccine, and then they're distributing them. They have a few left over, and that maybe you can get on a wait list or something at a pharmacy, so that if they have 4 doses left, they're not going to do a big call, but they want to put, you know, they want to use those vaccines. Is that something that people should think about doing as well?
You know, that's a possibility made to them. Certainly, above all, we do not want a single dose wasted. Much of the pharmacy partners that we've allocated doses to, and they're helping us coordinate lists, we've provided them with that kind of wait list or buffer list because we definitely don't want to run into those situations at all.
Great. And now, Suresh, specifically for UIHC, we did have some questions about, will UIHC automatically contact the patients that are a part of their system already, or is there anything that a patient should do to show their interest in the vaccine?
Sure. So there are multiple parts. So number one is that if you have been a patient at UI Healthcare over the last several years, there will be both an online way and a telephonic way to say that you're interested. Again, the online way is probably the easiest way for folks to do that. Since the beginning of the vaccination program on our website, off of the hospital COVID website, there is a way for patients that have traditionally not been UI Health patients to also express their interest. We have, during this pandemic, very much tried to work with the county health department in terms of implementing the vaccine shortage order. And so we have significantly used our own analytics to give this to the oldest patients and those patients with the most significant risk factors that we know. So presently, when you look at the large numbers that we do have a very high proportion of older patients and those with complex healthcare conditions that we know about. However, we're still feathering in other people as well. And I think as we move forward, that's there. So a lot of younger, healthier patients will say, hey, UIHC hasn't contacted me yet. And the answer is that is by design. That presently, in the spirit of what we're trying to prioritize right now, it is older, sicker, more complex patients. And that's why some UI healthcare patients have not heard from us yet with an opportunity to express interest. We anticipate that at the present rate of supply, if nothing changes, that virtually all UI healthcare patients will have had an opportunity to express interest by no later than the end of April.
That is wonderful news.
So if you just kind of look at it, that doesn't mean everybody will get a dose in April, but I think that we will be moving so far down our lists that virtually everyone will have an opportunity to express interest by April. But knock on wood, we've always gotten, the supply has been better than we anticipated. And the county has always innovated faster to kind of work with other people in the state to make stuff happen. So it could be sooner than April. But I still think that we're right on track in this county to substantially dent all adults in terms of being able to give them an option of a vaccine by the end of April. I don't think that means all adults are guaranteed an option, but I think we're going to be very significantly in a different place in 6 weeks.
That is great. So can one of you provide just an outline? We hear the term phase 1B. So who are those individuals? What are those characteristics of the people in phase 1B that are eligible for the vaccines now?
At the beginning of this, the state had stood up their Infectious Disease Advisory Council, and a wonderful group of roughly 20 to 30 individuals did their best to answer the toughest question that we're faced every day of who gets vaccinated first. And so throughout this entire time, and we can anticipate through the rest of the shortage order, we've seen those who are age eligible and then certain occupations who have either they're at increased risk or however. And so initially we saw phase 1A be primarily long-term care staff and residents and healthcare workers. Why? Because we saw outbreaks in long-term care facilities across the nation that were devastating. Healthcare workers make sense because they're treating patients, and some of them were in the toughest positions at hospitals like ICUs and other units that were treating actively infectious COVID patients. And so that made sense to get those folks done. Now with phase 1B, we're starting to dip into other occupations that are we'll say for all intents and purposes, essential to other functions of society. And I'll say that, for all intents and purposes, because what we've recognized throughout the entire pandemic, there are a lot of folks that are essential, but unfortunately we're not included in phase 1B. And so, that is frustrating, and we'll absolutely acknowledge and admit to that. But for right now, with Tier 1 Phase 1B was primarily educators and first responders, daycares. In Tier 2, we're looking at persons with disabilities and their care attendants. And we're also looking at frontline essential workers in the manufacturing industry that work or live in congregate settings. And so that's really a key piece, and the state has just recently provided a lot of clarification around that. So it's really a two-factor kind of eligibility process. It's not just in the industry, but it's in the industry, and really they're living or working in a setting where they're not able to socially distance. Tiers 3, 4, and 5 are other populations. And to be very honest, I don't believe we'll have many of those in Johnson County. So really, Tier 1 and Tier 2 are what we're working with right now, primarily. But again, it's in Tier 3, it's staff living in congregate settings. Most of those folks have been taken care of in Tier 1 and 2, and certainly in Phase 1A. So Tier 4 are inspectors for health. The state originally mentioned that throughout the entire state of Iowa, there's roughly maybe 1,000 folks. So you can imagine not too many persons that are eligible in that tier, and the Tier 5 are correctional facility staff. So we're making good progress. We've come a long way since December 14th, and it's really important to remember that. And from all intents and purposes, what we've been hearing from our state and federal partners, vaccine supply is going to increase.
Excellent. Thank you, Sam. So I think, I, along with many people, were very happy to see our K through 12 faculty, teachers become vaccinated. But we did have a question come in about university faculty, and that, it's a different population, it's a different group. How are they looked at when you're looking at those tiers?
Right now, we know that clarification has been that it's not been university or college level faculty and educators at the moment. Really, the state had looked at the pre-K through 12 population. So we hope as time goes on, or as supply increases and there's wide availability, that we'll be able to get to those folks too. But I think we'll be at a pretty pivotal point where supply will be exponential. And then it will just be very much available to everyone.
Thank you.
Barb?
Yep, go
I
ahead.
would say that, one comment needs to be made. I mean, as a member of the university community, there are things that just continue to be disappointing. And at every moment in the pandemic, it's difficult to deal with the disappointment, and then it gets better, like Sam said. And not every guideline was voted on in Iowa City. And so I think that if we had had a vote of legislators in Iowa City, maybe, college educators would have been included with K-12. But that was not what happened. And, Sam and I are executing a plan at a certain level that we didn't get to write the rules for. And I will say that we continue to be confronted by what I would call comparative unfairness. You have people that work at UI hospitals and clinics. What kind of role were they in? And they got vaccinated, but they're involved in patient care. But I work in a research lab, or I'm a professor who's in a classroom, or these other things. And these are the kinds of disappointments that we've had to deal with throughout the pandemic. That when you have a vaccine shortage order, the lines are going to get drawn somewhere. And being on one side of the line, you're grateful to be included, and on being just on the other side of the line is very unfair. And it's really, really important to make sure that in these moments that we don't use these disappointments as reasons to drive ourselves apart. We all know in this town the absolute importance of the universities. We know the value of our professors and our faculty and our researchers, and that right now they're not included. But I will tell you that Sam and I continue to advocate for any channel to justify, vaccinating the broader university community. I mean, it is the largest employer in this town. We do have infrastructure to vaccinate the university really fast if we can be given the supply. But I do want to say that this advocacy happens continuously. We would love nothing more than these criteria to include more of our eligible citizens of Iowa City and Johnson County. But the reality is there's a tremendous amount of disappointment around this. There's also a tremendous amount of disappointment around the definition of an essential worker. I can tell you that, we constantly have to go get clarifications from the state. Why not this group? Why not that group? Honestly, half the time you could flip a coin. But with a vaccine shortage, there is some logic that we can understand and a lot of gray area. And so if there wasn't a shortage, I think that everyone could broaden the criteria. But right now with a shortage, I just want you to know that Sam and I are well aware of the disappointment. It's not something we're happy about, but it's a reality of the shortage.
Understandable. So we do have a question here about once someone is fully vaccinated, are they immune from getting the virus, or are they only protected from the side effects of the virus?
Again, as we've mentioned before, the vaccines that are available are safe and effective and very effective against hospitalization and serious illness. Just recently, the CDC had made a note that it looks like all signs are pointing to it's having an effect on stopping transmission from person to person. And so we've seen some recommendations of what persons can do. And certainly, I think the one thing to point out to that is if you're in a group of other vaccinated persons in your home, you are safer to be unmasked with them. But that's not public settings. Again, the call to continue to do all of the measures in public settings with other folks is still there. And so I think that distinction has to be made and very clearly spoken and talked about so that we're not under the misunderstanding that, I got vaccinated, I'm able to go back to pre-COVID normal because that's not the case right now. As time goes on, we hope to hear more and learn more about how effective the vaccines are on many fronts, but that time isn't now. So
I will say that we're in this moment where we have to balance messaging. On the one hand, it does seem increasingly likely that the vaccines are successful in preventing transmission. Just today, Pfizer and Moderna released studies that show that it's definitely effective in preventing asymptomatic COVID. And so again, it's more promising that these vaccines are effective at multiple modes of preventing transmission. We don't want people to hear that message and then stop the safety measures, because the reality of the situation is the majority of people are still not vaccinated, especially when you include children in the definition of people. And so it's really important that in these public settings, we do not normalize, abandoning safety measures. And so even if you have two people that are vaccinated in a public setting, they have an obligation to follow the community standard and wear face coverings, avoid congestion and cramped public gatherings, and always follow distancing. And so we have a community obligation, regardless of whether you are vaccinated or not, to set the standard that we want to follow the safety standards.
Thank you. Now, as a follow-up, is this vaccine somewhat similar to the flu shot? And is it something that people will need to get on an annual basis? Is this a one-time done, or is it simply that we don't know?
I think that we know that the vaccine has over a year's worth of effectiveness. So when we talk about it, it's not so much that the vaccine quits being effective after 3 months or 6 months. But what we know, just like with the flu, is that there could be variants. And if there are variants, is there a need to do a booster or a different vaccine, et cetera? The good news is the world is very focused on this question, and there are numerous pharmaceutical research and other enterprises that are attacking this question in multiple different ways. So I think just as fast as we had a generation of vaccines show up here for a previously unvaccinated disease, I'm optimistic that in 6 months, 9 months, in a year, that we'll have better answers to this question. But at this time, I think fundamentally we don't know. But I don't like this idea that is out there that somehow the vaccine is not effective after 6 months or 9 months or 12 months and you'll have to get another one. That has not been an active discussion amongst anyone of substance yet. There hasn't been data to suggest that you need to do that. So I don't know, Sam, if you have anything to add.
No, I think that covers a lot of it. Again, yet to be determined, but certainly by no means is this a situation where, it's not as good, get it again or anything like that. It is very safe. It is very effective. And we hope to learn more in the future, and we will.
So once someone is vaccinated, is it safe to travel? Or safer to travel?
That's a good question right before spring break time, right? It's a good plan. Right now, looking at other public health experts and the CDC, it's really still recommended not to. We're really wanting people to still be safer and take those precautions. We know that is hard to tell people and ask of folks, especially after a year of this, as weather gets nicer. But really, again, the ask is to continue doing everything that we can to make our communities safer and stopping transmission. Because again, as Suresh alluded to, not everyone's been vaccinated yet. So
I would also say that, traveling goes a spectrum. I mean, going out to a state park with the family and visiting that is different than some other decisions that you could make. So I think that even if you are traveling, there are decisions to be made. Airports are very busy settings these days. It wouldn't be bad to avoid them. Avoiding other congregate settings is important. I think still following social distancing rules and safety standards wherever you are. So even if we are moving into the phase where people feel like they have to travel, I think we need to now talk about the safer ways to travel. Traveling by private car, avoiding congregate settings, only interacting with people that are in your own household. All of these are important measures that if you must travel, why don't you continue to find ways to do it in a safer way?
So as a follow-up to that, I'll give you a scenario. So there is a pair of grandparents who have now been successfully vaccinated, and they'd like to see, one of their children, that children's spouse, and their grandchildren. Now, of course, the children and the grandchildren have not been vaccinated yet. So, is it safe for them to do it, or what precautions should they take if they do visit with those family members?
Need one detail, Barb. Do the grandparents like the spouse of their child?
Okay, let's assume that it's a wonderful relationship between them all.
In all fairness, the way we've been answering this with our employees for several months is that in general, we would want grandparents to minimize their visiting of non-vaccinated people, especially if they are not living in the same household. But it has been a year, and it is really difficult. If there is going to be a visitation, that we still continue to follow the safety standards is the issue. But I would defer to Sam as to whether those are appropriate guidelines.
No, absolutely. When we're looking at this, it has been a tough year. But again, when we're talking about travel, there are ways that we can do things safer. And certainly if our grandparents are wanting to see their grandkids, the preference is that the grandparents are fully vaccinated. So if they've gotten either, more than likely they've had the 2-dose series, that's 2 weeks post their second dose. And so really that's one way to be more assured. And then certainly if the visitors are not feeling well, to not visit and postpone that. So again, as we contextualize a lot of these situations, there are ways that we can do it safer.
Thank you. So, we have about 10 minutes left, which gives us a good time to kind of try to summarize those things. But I think a lot of us know or would like to ask, what can we as a community do to help reach those who are the most vulnerable?
That's a great question. I think what we would ask the community is to do what they've been doing, which is wearing a mask and distancing themselves, avoiding those congregate settings or congestion points, to continue doing that until we know otherwise. That's a huge part of it because it's getting very tempting to not do those things. In terms of vaccination, please reach out to your loved ones or neighbors and ask them, like, hey, I think, I'm going to assume you're eligible, by age or certainly by their relationship that they know them by. Ask them, do you need help getting vaccinated? Asking your family members or neighbors or friends is a tremendous amount of help, because you'd be surprised what, just a little assistance can do to help folks. So
I think the other piece of it is that, being a United Way board member, I think the United Way brings together a broad coalition of organizations that regularly have relationships in the community. And I think the first message that we need a lot of help with is now's the time to get the vaccine. If you are eligible, it's safe, it's available in the county, and there are people that can help you figure out how to get it. I mean, I think that there is still a lot of reluctance amongst these communities that we want to see. I think that the fact that it's a 2-dose regimen also makes it practically more complicated to get it to folks. But we know now's the time to start talking about vaccine readiness, because we anticipate soon that we'll even have a single dose solution in the county. But people have got to want it. They've got to know that they're eligible. They've got to know that their own community leaders or their own friends or their own family think they should get it. And I would say that what we have found is that on top of the challenge that some of these communities may not have access to internet, may not be able to get off work or whatever it may be to get to the vaccine, we've also seen a significant reluctance. Is it really for me? Is this something that I should do? And I think that's something that the whole community can do, because we see a pretty big divide. We see a large number of people that are very eager to get their vaccine and are wondering why the criteria isn't this or why the criteria isn't that, because they want it now and why can't they have it? We need to remember that there's an equally sizable amount of our community that believes this is not for them. And I think that we could continue to use help from all of our community members and partners in talking through the value of getting vaccinated in a timely manner.
I agree. And I think that there are many organizations that are happy and ready to help with that. And that's a good message to share with everyone. So before we close, are there any final comments that either of you would like to make to the audience?
Again, just a great amount of gratitude and appreciation to everyone. It has been a long year, but through so many partnerships, through so much volunteerism, we continue to make our way through this pandemic to meet those struggles and those low points. We get through them together. So again, a lot of appreciation to everyone for their patience throughout all of this. So thank you.
Yeah, I would echo that. I would also just say, how cool is it to be in Johnson County? I mean, it's a pretty good gig. I mean, this is a really great community. I would just broaden the kudos. I mean, thank you to Mercy for doing such a great job, Towncrest for doing such a great job, each in their own ways kind of doing that. But beyond kind of the healthcare circle and the VA, beyond the healthcare circle, I think this has just been how important the employers and the businesses and the city governments have been during this pandemic. We can't tell you enough. A lot of people only believe something when they hear it from their employer, when they hear it from their councilman, when they hear it from their fellow community member. And I just want to thank everyone for being advocates, for being patient, for not giving up on us. I mean, presently we're disappointing you with vaccine guidelines. Before, we were disappointing you with testing. Before that, we were disappointing you with PPE. we've disappointed you over and over and over again through this pandemic. And I appreciate your resilience and I appreciate your patience for understanding that we're not doing it intentionally. We're not doing this because we don't care about this community. We deeply care about this community and we're humbled to serve it. But I just want folks to know that there is a light at the end of the tunnel. And we have a lot of great people here in Johnson County, but let's not fumble the ball right before the goal line. We must continue to sprint to the finish line, and that includes following our safety standards. That includes making sure that we don't need to slow down our vaccination campaign to start treating a lot of COVID patients. You know, our healthcare organizations, others right now have greatly benefited from our hospitals and clinics not being overrun with COVID positive patients. You know, and so that's why we have staff available to vaccinate and to call people and to do all of this stuff. So please continue to follow the safety standards and please continue to encourage the community to embrace the vaccination program.
Well, I want to thank both of you for taking your time today to share your knowledge, your expertise. But in addition, I just really want to thank you for the great work that you're doing. I know you sound like you're a little hard on yourself. We've disappointed you here. You have been thrown quite the curveball. And I think that both organizations have done a stellar job of adapting, pivoting, doing what you can to take care of the community. And you have both been great at it, as well as your organization. So definitely a sincere thank you from me and from the entire community. To our attendees, I want to thank you for attending and joining us today. I also want to thank you for all those great questions that you submitted. Please remember that there will be a video of this that will be emailed to all registrants. So if you want to share that with others, you'll be able to do so. And I really do want to thank the United Way of Johnson and Washington counties, because they have done a tremendous effort in this. And so I did learn that today also marks the 1-year anniversary of the United Way's big email campaign. And if you haven't signed up for those emails from the United Way, I highly recommend that you do, because you get a lot of great information about how you can get a vaccine, how you can help your neighbor, all kinds of great information. Please make sure you get that email. But the staff at the United Way is doing a stellar job of trying to make sure that the people in our communities have the information, they have the resources, and they have assistance if they need it. So kudos as well to the United Way of Johnson and Washington counties. And with that, we end our program. Again, thanks to all for participating and joining us. We hope that you remain healthy and safe and have a great day. Thank you.